We now know that signs of brain damage, Alzheimer's, are occurring 20, maybe 30 years before the actual outward signs appear. And I think it's really important for realizing, okay, I'm in my 30s or I just turned 40, I don't really have to worry about it because I don't really care what's going to happen, when I'm retired and I can sit in my easy chair. But these are steps that every one of us, regardless of our age, needs to take. When I was a pediatric heart surgeon, I could actually see in the blood vessels of children and teenagers that I operated on already plaques on the inside of their blood vessels. The Vietnam War, where a lot of our guys came home in body bags, these guys in late teenage years, early 20s, had plaques in their aorta, in their coronary arteries, and as young people. So you're right, it's never too early to start making these changes.
No, I mean, unfortunately, we're seeing hypertension increase in prevalence in children and adolescents. We know that hypertension damages the blood vessels that go up to that feed your brain. Blood, oxygen, antioxidants, building block nutrients. Today, at least 1 in 7 adults has a memory complaint, has some form of subjective cognitive impairment. 1 in 6 adults is on some kind of psychiatric drug. Generally, that number shoots up to 1 in 4 for women over the age of 40, which is heartbreaking to say the least. I mean, before my mom had a diagnosis of dementia, one of her physicians, a psychiatrist, actually thought that all of her symptoms were due to depression, which is really quite sad when you think about it. The willingness to just chalk up the symptoms that we're having to depression, right? Especially in women. Now, there are some kinds of dementia that symptoms that may look like dementia when somebody is clinically depressed. It's called a pseudo dementia. But yeah, people are not generally happy with the way that their brains are working, and rates of Alzheimer's disease and Parkinson's disease are increasing. And as you mentioned, they begin in the brain far earlier than the presentation of symptoms. And this isn't just a question of diet. It's a question of our lifestyles. We are more sedentary than we've ever been before. We also live in environments that are increasingly polluted. There are a number of studies that are coming out from very polluted parts of the world that are showing us that air pollution in particular, fine particulate matter, PM 2.5, actually can pierce the blood-brain barrier and can instigate pathology that's really similar to Alzheimer's disease pathology, but decades before Alzheimer's disease would typically emerge in the brain. So there are all these different factors, but I think food is something, it's such a potent leverage point because we all eat at least 3 times a day. We know you eat once a day, Dr. Gundry, but most of us eat 2-3 times a day and snack in between. So with every bite you take, that's a choice that you make for your cognitive destiny. And again, it's that leverage point. And one of the reasons why I wrote Genius Kitchen is because beyond conversations about protein, fat, fiber, one of the most powerful leverage points that a person has is just cooking at home more, learning how to cook at home more. When you can make the same dish at home that you would get out at a restaurant, and it's going to have fewer fat calories, fewer calories overall, less sodium, and also improve the dynamics of your family while you're at it. Cooking at home with family members, loved ones, it's one of the best ways to bolster relationships, to bond, to communicate, to express love. And these all play a role in living a genius life, in helping to kick the can down the road with regard to Alzheimer's disease and other forms of dementia, right? Social connection plays such a huge role. And there's no better way to show love to somebody than by cooking and sharing a meal with them.